Hello everybody and welcome, dear doctors. I am Emily Perry and welcome to the Hebe Medicare podcast. Today I'm very honored to have here with me my dear friend, Professor Demetris Savva. Welcome.
Thank you, Emily, for having me. It's a pleasure to be here, and I'm ready to do some exciting masterclass with our dear colleagues from Cyprus and the international doctors.
Absolutely. So, me and you, we've been knowing each other for more than a year now, I think.
Yeah.
And finally, we found time in your tight schedule to make this
True,
done.
Yeah. Quite busy schedule, but we managed to create 3 amazing masterclasses for the doctors here in Cyprus. I think they will be very excited with the topics.
I'm very honored and blessed that you find a place for us.
Pleasure is all mine.
Yes, and I'm grateful and I thank you for that.
Thank you very much for the invitation.
So before we start and we reveal what we've prepared for our community of doctors, let's start by talking a little bit about who you are, and about the schedule I've just mentioned, which is completely crazy, right?
Yeah, quite busy. So for you that don't know me, I'm Professor Demetris Savva, plastic reconstructive surgeon, and I'm based between Italy, Greece, and Cyprus. I'm mainly focused on facial plastic surgery and breast reconstruction surgery. And besides that, I'm into facial anatomy and international teaching worldwide and at university based. That's why the busy schedule.
Almost nothing.
Yeah.
Between bed and breakfast.
Yes.
So you actually just came back from Istanbul yesterday,
Yeah.
right?
We had an amazing cadaver training for facelifting. Lots of international doctors. It was very successful training.
And last week you've been hosting and conducting another international training
Georgia.
in Georgia. Another cadaver training.
200 doctors only in cadaver training, and also hands-on training with threads and injectables.
And you are a professor in the Academy of Aesthetics in
In
Milano.
the University of Camerino and in ICAM. I'm a professor there in the Master of Aesthetic Medicine, and also a contract professor of facial anatomy in the undergraduate students.
And you have a clinic in Greece and a clinic in Nicosia.
Excellent. Exactly.
Oh my God.
Busy.
Very busy. Very impressive.
Thank you.
Yes, and you'll not only look young because of you're in the right field, you are also actually young. I think that among all the doctors that I've been working with, you're the youngest one with such a long, reference and experience, and everything that you're doing is chapeau. Really very impressive.
Thank you.
Very
I started
impressive.
quite young, and every year I'm evolving. That's why the busy schedule.
Unbelievable. Believable.
Believable it is.
Hard work pays off.
Yeah, exactly.
Good. So, putting aside a little bit the position of the expertise and all your knowledge, tell me a little bit about you, who you are as a person.
So as we have said, I have a quite busy schedule, so most of the times are between flights, between airports, but in my free time I like to read some books, get into the knowledge of advancements in medical aesthetics and facial surgeries, but generally I'm focused 100% 24/7 in the field.
In the work, in the field.
Not a lot of free time.
You're living and breathing
In a plane.
your specialty, yes.
Yeah.
In a plane.
In a plane.
So, one interesting question is that I'm asking all my colleagues, how do you see the world of aesthetic medicine now comparing to where it was, let's say, 5 years ago, and where will it be 5 years from now?
So, as you know, the previous decade, the habit of the doctor and the patient was more and more product. That is changing the last 2 years to the motto that I also use in my clinic, less is more. So patients want to do something, but don't show so much, not so much volumizing. They want more healthy skin. They focus more on regenerative and on longevity. Combination protocols is a new thing that we started these years, and I think it will be the it thing for the next couple of years. But we have seen that volume is not the must thing that we should do and what the patients are asking from us. So new technologies regarding regenerating medicine, longevity in combination with hormones, as well as the injectables, will provide the satisfactory results for our patients.
Good.
So we are heading to less is more, which is good in my opinion.
Which is very good. And where will we be in 5 years from now?
I think we will focus more on longevity treatments, both injectables and IVs and hormonal changes.
IVs. Do you believe in IVs?
I believe in the whole concept of the holistic combination treatments of injectables, your cosmetics, your IVs, your supplements, and your diet.
Exactly. This is very
Because
important.
if you just do your injectables, you do nothing.
Yeah, it's true. Yeah, I believe so too. And it's very important also your vitamins and your diet and your exercise and everything together.
Yeah.
Yeah, building a one strong...
The combination of this, I think, gives you the maximum result.
Absolutely. So, tell me a little bit about your day-to-day life. I mean, as a plastic surgeon, as a professor, I mean, how does it look, a day in your life?
So the days I have surgeries from morning, usually till late afternoon. So that days are focused on my surgical patients. And the other days I split them between university and office practice, again till late in the night.
So how does it look like? You're like an early bird waking up in the morning?
So for me, because I love what I do, I love my work, it's not like a bad thing to do. So I don't feel bad waking up early in the morning and attending and doing what I love, because I like my work, I like teaching and passing on knowledge to fellow doctors. So I find it very keen and very useful to do it every single day.
So you're living your dream.
Yes.
You're very lucky. You wake up in the morning to another ambitious day that you actually like everything you're doing.
To share my knowledge.
Yes. This is beautiful. So between all the things that you're doing on a weekly or a monthly basis, what do you like the most?
I think what I like and enjoy most is teaching and passing on the knowledge to new doctors, but also to experienced doctors, because my teaching philosophy and embedding the anatomy background that I have, I think it's not only for the young doctors to learn new stuff, but also for experienced doctors to implement the anatomical knowledge into their practices and be better doctors for their patients and also for themselves. So sharing knowledge, I think, is the top.
What is the most important thing you want to teach your students?
The most important thing that I teach my students is that not every phase needs every product, and not every product is for every phase. And this is what I will try to explain in these master classes.
Okay. So talking about this master class, a few months ago I approached you and I told you, okay, come on, let's do it. Let's finally do it and think about topics for the collaboration that we want to establish. And then you came up with this brilliant idea and you told me, you know what, Emily? All your trainings are very important and interesting, but all your trainings are about a product or about an active ingredient, a specific active ingredient. Let's do a training differently. Let's do a training about an indication, about an area. So explain to us a little bit.
So my concept in my trainings, I always like to see the whole picture and not focus on a single ingredient or a single product, because a hyaluronic acid filler, any doctor can place it. But understand the whole anatomy, the skin, the fat compartments, the atrophy of the bone, and work around that area. I think not a lot of doctors are capable to comprehend this whole idea. So through these master classes, that we will do 3 master classes, the first one we will focus, shall I tell them?
Yes, of course.
I thought that, okay. So we will do 3 master classes this autumn. The first one will be all about the neck. So the neck region is quite a complicated region. A lot of aesthetic doctors are afraid to work with that in depth. So I will try to explain to the doctors through my anatomical knowledge and through individualization of the patients that we have, how to examine a patient, the neck of the patient, the layers of the neck, because you see, for example, a laxity in the neck. It might be due to skin atrophy, it might be due to the platysmal bands, it might be due to different factors. If the doctor is not able to understand what is the underlying anatomy, he will not be able to use an excellent product and have an excellent result. So by knowing the causative region that you have the problem, he will be able to make a specific individualized algorithm for his patient and treat his patient correctly and efficiently.
Beautiful. So the first training, this first seminar is all about the neck.
Yes.
And the second one?
Our second will be in October, and we will focus on the periorbital region. Again, a very tricky area, a very complex area, because again, we are not just treating the hollowness under the eye. We are treating hyperpigmentation, we are treating just shadowing, we are treating volume loss. So by treating just the under eye with just a filler, we don't make a harmonious upper face. So through this masterclass, I'll try to explain to the doctors how we identify each of these causative features and what product we should use for each specific cause. And in that way, we will have a harmonious upper face.
Beautiful. So all the products are available
Exactly.
to treat the
we
cause.
don't focus on one product. We don't focus just on volume. We focus on all the causative.
So it can be a skin booster, it can be
volume,
polylactic acid, volumizing with hyaluronic acid,
exactly.
peeling, like a lot of things.
And every product
Peptides.
individualized on the specific patient.
Exactly, according to the specific problem that you can find.
Yeah.
Beautiful, beautiful. I like this idea. And then the third one on November.
And the third one, which is again, I think the most interesting of them all, and
This is
most
why
of
it's in
the
the end.
doctors asked for it, demanded it, so we will have it. It will be about the periolar region. And what I always say to my patients when they come and they want just lip augmentation, I try to explain them, even if I make you the perfect lips, if the periolar region is not treated, it will not look nice. So by just volumizing the lips, without treating the nasolabial folds, the skin on the chin, the smoker lines, and the mandibular angles, it's just putting a stone in the water. So we'll try through, again, the anatomy knowledge to identify all these regions, layer by layer, what product can be used for each causative region, so we will have a harmonious lower face.
I'm so happy. This is so exciting. This is brilliant.
Thank you.
The idea.
I think the doctors will be very interested in all three master classes.
Yes, and I think
because
that
there's
they're
something unique.
Very unique. Very unique, very special, very different.
Exactly.
Yes, I'm very excited about those
I'm
trainings.
very excited too.
Good. So tell me, after all those years that you've been doing what you're doing, what is your greatest achievement?
So I'm sure you will think that I will say about multiple awards, achievements, certificates, but for me, the greatest achievement that I can have as a plastic surgeon and as a professor is to see my doctors that I teach them apply what I taught them perfectly on their patients, or see them getting on the podium in a congress and speak confidently. And in that way, I feel that I achieved my goal for them to build them up and make them think outside of the box, think above the rest, and see them moving on and on and on. That is the greatest achievement for me.
I have another interesting question for you, because some doctors, they're practicing aesthetic medicine, and some doctors are building the future of aesthetic medicine. I consider you to be the second group.
Thank you.
So I'm curious, in your eyes, what is the biggest trend that is about to come and you recognize that will be in a very big demand in our market? I mean, what is the need that is about to reveal here and the future, the nearest future will bring results to?
So we have already seen the last couple of years regeneration medicine more advancements in regenerative medicine, and we have seen also in the last congresses worldwide the implementation of hormones in the whole holistic aesthetic approach.
Hormones.
And I don't mean just supplements, hormones, or injectables hormones. We have seen them being implemented into injectable products for the face or into creams, pharmaceuticals. So I think the combination of the hormonal pathways directly on the face or on the neck or the body will use, I think it's the new trend that we will deal with in the next couple of years.
Me personally, I still didn't hear about hormones.
It started in IMCAS this year in Paris. They started having a couple of talks, but in a couple of clinics around the world, they started using supplement hormones as complementary of the holistic approach of the injectables.
For any age?
No, you do your checkups, your hormones, you see what you need, what your body needs, what you need for that specific reason. For example, for hair loss or for women who are in the menopause phase to balance them out. But they started now implementing also in pharmaceuticals and also in injectables to stimulate directly the signal pathways directly in the area of that.
And where do you inject those hormones?
They are still in the trial phase, obviously, but you inject them directly in the area that you need to treat. So they do the signaling pathway directly on spot.
Very interesting.
So I think this will be the new trend.
Very interesting. Thank you for sharing that with us. After teaching and training so many practitioners around the world from different cultures, from different countries, tell me, in your point of view, what makes the difference between an average injector to an exceptional one?
Very nice question. And this makes a huge difference in the market, especially in small countries like Cyprus. You don't need to be an average injector. You have to be exceptional. And what makes the big difference between the average doctor and the exceptional doctor is that the exceptional doctor doesn't know just the best product. He knows the anatomy, as I keep telling throughout this podcast. He knows what layer lies where, what lies in which layer, what needs supplement, what doesn't, what type of treatment it needs, because we don't just need, for example, a volumizing filler. We need to treat the skin with peelings, with mesotherapies. We need to treat the fat layer. We need to supplement any bone atrophy. We need to trigger the ligaments, the biostimulation of the whole layers. So an exceptional doctor will understand what his patient that is sitting in front of him need. He will choose the best products for that patient, and that will make him exceptional and not an average doctor.
So it's not about buying the best product.
No.
It's knowing where to place it, when and why.
And to whom.
And to whom.
And to whom, the most important thing.
I completely agree with you. And this is exactly the reason we are inviting the doctors to participate in our trainings.
Because through these master classes, we will not teach products. We will teach a complete area, perioral, neck, periorbital, and they will identify what needs to be done on every single patient with the required products and build the individualized protocol. And that's what they should do.
According to the understanding of the anatomy of this specific area. Yes. So we believe in knowledge, and we believe in growth through knowledge, not through a new product in the market.
Exactly. Through anatomical knowledge and knowledge of your patient that sits in front of you, and not just the product.
And not just the protocol of the product from the manufacturer. Yeah, I completely agree with you. So those 3 master classes, who is it for?
So master classes are not designed for beginners or experienced doctor. Any doctor from beginner that know the basic stuff or advanced injectors can attend these master classes, because we'll cover the basic anatomical layers, as we said before, but we will cover basic injection techniques with needles, but we will also proceed to more advanced techniques with cannula, with stacking mechanisms, combination treatments that even an experienced doctor, I'm sure he will benefit from these master classes.
Thank you. So, Doctor, I want to thank you for opening up and sharing a little bit about yourself.
Thank you, my pleasure, it's all mine.
And quite a lot about your knowledge.
Thank you for having me here.
Thank you for coming. Please tell the audience, where can they find you?
So, dear doctors, you can find me on Instagram, LinkedIn, and Facebook, Dr. Aesthetic Med.
Good.
Thank you.
See you very soon.
See you
in the
September.
seminar days.
Yes.
See you in September. I'm looking forward to it.
Exactly the same.
Let's do it.
Perfect.